So let's talk about Medicare age. It's record numbers now because they are just reaching that point.
Absolutely. And last year, Hannibal Regional Hospital approached us because they have a lot of patients who are reaching that age, and they had a lot of questions. Mm-hmm. And when they come to my office, they have a lot of questions. So we thought it would be a good idea to put together some educational meetings to explain to them what the steps are, what they need to do, and how all the pieces and parts of Medicare work.
Okay. So there's a lot of confusion, what you do, what you can't do, how you do it, etc. So you're going to help kind of straighten them out and get them pointed in the right direction.
Right. I mean, what we do is we talk to them about what we call the ABCDs of Medicare. Medicare Part A, of course, comes to you mostly automatically if you go on Social Security, and that's what provides you your hospital coverage and possibly some skilled nursing coverage. Mm-hmm. Part B, you pay for that. It's usually $104.90 a month for most people, and that covers your outpatient coverage, covers you for seeing your doctor, that type of thing. One of the newer things that's been around for a few years already, but it still creates a lot of confusion, is Medicare Part D, which is your prescription drug plan. And so we help guide people with that. And of course, Medicare doesn't cover everything, so there's things that you can do to help close those gaps. One's called a Medicare Medigap coverage or a Medicare supplement. And another one's called Medicare Advantage, which is the C in the ABCD.
Okay, I'm already kind of confused.
Yeah. And that's why we're having this meeting, is to help people understand what we're doing. Is we're going to have a series of town meetings all over northeast Missouri. And even though I'm an insurance agent, this strictly is an educational meeting. Matter of fact, it is regulated by Medicare. We cannot take your name and call you later. We can't try to sell you anything at this meeting. I mean, we'll leave business cards if you want to contact us. If you have questions, we'll be glad to talk to you, but this is not a sales meeting. This is strictly educational meeting, and it is so strict that Medicare may have a secret, what they call a secret shopper there, to make sure that what I do is in compliance with what they want done.
Understood.
So how do you break it down for somebody when they ask about Medicare to say, this is what Medicare is?
Okay. Yeah, I mean, basically, I have a cheat sheet that I use, but the one tool that really helps, and if we can get people to do it, Medicare.gov is the website, and you hear people talk about the Affordable Care Act website and all the issues there. The Medicare website is an excellent tool. I mean, you can actually do some enrollment there, and what we really like about it is the drug plan options, because every state has probably 20, 30 drug plan options, and each drug plan has different formularies, which means what drugs they'll cover, which drugs they won't. What this website will do is you go to that, you put in your information, you enter in your prescriptions, the dosage you're taking, how many you take a day, what pharmacy you want to get your prescription picked up at, and then what it'll do, it'll tabulate from the least out-of-pocket cost to the most out-of-pocket cost, and they factor in your premium, your deductibles, what you're going to pay for your prescription. It's all calculated in there, and it makes it very, very easy to pick the right drug plan. And the key to it, too, is you have to do it every year, because we'll have companies change their plans every year. They change their what's covered under their formularies. I had a gentleman in a couple years ago that was taking a prescription that was costing him $45 a month. Well, that company changed their formulary, and next thing is it's going to cost him $450 a month.
Wow.
They took it off the formulary. So what we did was we just moved him to another plan. When you enroll in a new plan, it automatically disenrolls you from an old plan. So I mean, some people have taken out a drug plan and kept it for years, and that's cost them a lot of money. They need to check it every year to make sure that the plan they're on is the right one for them.
So not only to go to that site and look for information as you're entering into it, but also to keep it updated through there annually. What's the age, the Medicare age that you mentioned?
For most people, it's 65.
Okay.
Unless they're on due to disability.
And they know that they're eligible earlier than that. But 65 and older, are these folks using the website?
A lot of them are. I mean, we're seeing a lot more. As time goes by, they're getting to be more and more internet savvy. My mother's big on Facebook now, and we're seeing that be common. But there's some that don't. They never have had a computer, and we help them, or we encourage them to get their their son or daughter or grandchild even go in and help them do it. I mean, it's like I said, it's very user friendly, and it's a really it's a very impressive site to me.
For people who don't use a website, don't use a computer, maybe don't have access, what do they do?
I can help them. A lot of times in the community, they'll have at senior centers, somebody will come in and help do that. And a lot of times the pharmacies will help you. You can go to your pharmacy and they'll help you as well.
I understand, too, that speaking of Part D, aren't we not coming up on an enrollment period?
Yes, and that's the timing of these meetings, because October 15th through December 7th is the open enrollment for Medicare.
Okay.
And then a month later will be the Affordable Care Act for everybody else who's under 65. One of the big questions we get at this meeting is, how does the Affordable Care Act impact me? Mm-hmm. And the answer is, it doesn't. But they hear there's been so much on the news that they think it's going to have an impact on the people that are over 65 as far as their coverage, and it really doesn't on their coverage.
Okay. All right, so that's good to have that clarified. So where are these meetings and when will they be held?
Okay, like I said, we're trying to do them right before October 15th. Our first one will be October 7th at Monroe City at the Nutrition Center, which is located at 314 South Main. Mm-hmm. That'll be at 7 a.m. to 8 a.m. That very same day, then we'll go over to Shelbina at the Shelbina Senior Center, and that's from 4 to 5 p.m. The next day, October 8th, we'll be up in Canton, Missouri at Culver Stockton College, and that's from 4 to 5 p.m. October 9th will be Bowling Green, Missouri, and that's from 4 to 5, and that's at the Church of the Nazarene, which is at 807 South Court Street in Bowling Green. And then our last one will be October 14th, and that'll be at the facility of Hannibal Regional Hospital at 175 Shin Lane. That's the smaller building that's located south of the hospital complex. If you'd like to come, we'd love to have you there. We ask that you RSVP by contacting each of those centers and the one you'd like to go to, and let them know that you'd like to come. And like I said, it's a pretty informative meeting. We've had very positive feedback from them.
Okay. So if you're over 65 or somebody who helps with somebody who's over 65, you should attend these meetings, right? Mm-hmm. And not only find out the information, if you're going to get signed up for Medicare, then tell your healthcare provider that you've done that, right?
Absolutely, yes.
All right. Good information, good advice there. And we can go to Hannibal Regional Hospital website or Hannibal Regional Medical Group, and the information is right there. Yep. We can also do it the old-fashioned way, give them a call.
There you go.
And there's information there. All right. Yep, lots of things. You got to talk about it, especially when you get to be that ripe old age of 65.
Very good.
All right, good information. Paul Frankebach, thank you.
Thanks, Paul.
That's Paul Frankebach with Trust GDC Insurance Services. Great informational seminars there being held. Find one near you if you're so interested. That's this edition of Healthy Dose, brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group. More information at hrhonline.org.